Thank you, LT. Well, thank you for joining us. We meet again for the first time since July. That in and of itself says something about the state of COVID-19 in Oklahoma City. In many ways, the situation is as serious as it has ever been. Yes, we know a lot more about the virus than we did in April. Yes, treatments are better. Venues where people gather have taken extraordinary mitigation measures to increase safety. Individuals have largely embraced the benefits and obligations of masking. And we can begin to see the promise of a vaccine just a few months from now. But when the virus finds its way around all those walls we have built, it is just as deadly, just as destructive. It still has no cure, and it is still taking the lives of our friends and neighbors. Many recall March 11th as their aha moment, when they realized this thing was real. I hope today to leave you with another such aha moment, if it hasn't already occurred in the last week. Perhaps through the distractions of ice storms and elections, you haven't yet faced what I am about to share. But the reality is that November has brought our third wave. It is now on our shores. It is time again for each of us to respond. As I have said at this podium before, there's no easy answers in this situation, only bad choices, but all things considered, we've been muddling through relatively well the last few months. When our first wave hit in March, we made a textbook response to a mysterious, once-in-a-century global pandemic. We, and virtually all cities around the country, sheltered in place. When the second wave hit in June and July, we had bought ourselves time, and we had learned a thing or two. So sheltering in place was no longer called for. First, we tried some targeted mitigation methods, and it stabilized the situation a bit, but the heavy lifting was done through a mask ordinance that drove cases and hospitalizations down 30 to 40%. At that time, we could look at our case counts and deaths in comparison to all other large cities over the course of the pandemic and find Oklahoma City almost at the very bottom of those lists. And that's a list you want to be at the bottom of. After stabilizing the second wave, over the course of September and October, we saw a gradual rise. You wouldn't call it a wave, but the steady incline over that period prevented us from entering the colder months from a position of strength. In fact, we entered November at our highest level of cases, near where we were during the summer's second wave. In hospitalizations, we were significantly higher than that second wave, perhaps 50% higher. This was how we entered November. And at that moment, across the country and in Oklahoma City, the tsunami arrived. This chart of new cases illustrates this. And if there is a chance you haven't seen this chart yet in the last week, I hope you're looking at it right now and receiving your wake-up call. Around November 1st, our 7-day average of new cases in the Oklahoma City metro was approximately 300 new cases per day. As we stand here today, November 19th, the 7-day average of new cases in the Oklahoma City metro is over 800 new cases per day. That is an increase of almost 3 times in less than 3 weeks. 800 cases per day is 16 times higher than the number of new cases per day we were averaging during our first wave in March and April. Cases are spiking right now across the country, but even in that relative environment, we're not faring well. As an example, Los Angeles is currently reporting 23 new cases per day per 100,000 residents. Dallas is currently reporting 36 new cases per day per 100,000 residents. Our number in Oklahoma City is 57. But here is the stat that really illustrates the magnitude of what has happened this month. 1 out of every 100 residents of the Oklahoma City metro has received a positive test for COVID-19 in the last 3 weeks. Let me repeat that. 1% of every man, woman, and child in this city has tested positive for COVID-19 this month. And those are just the people who felt concerned enough to get a test. You can imagine there are probably just as many people who did not get a test for any number of reasons, but were still potential carriers of the virus in the community. You have to assume that any room you have entered this month in Oklahoma City that had more than 25 people in it almost surely had someone who was actively infected with COVID-19. The virus is everywhere. These exponentially surging numbers brought the heartbreaking end of in-person instruction for many of our largest school districts, including districts that had just returned to in-person instruction for the first time after 8 months. Just as devastating is what these case numbers are doing and will do to our healthcare system and our overall well-being. As of this week, we have lost 408 residents of the Oklahoma City Metro during this pandemic. Because of the actions we have collectively taken over the last 8 months, that is fewer deaths than we had feared, and it is fewer deaths per capita than many other American cities. But it is still 408 lives that we have lost, and I send the deepest condolences of this city to every one of those families. Others who have contracted the virus may not die, but they are experiencing one of the scariest episodes of their lives. As of Tuesday night, the number of people in OKC Metro hospitals right now for COVID-19 stood at 484, with 136 of those in ICU. The hospitalizations are more than twice what they were in our second wave this summer. This chart of hospitalizations shows the escalation over the last month. I want to also mention that on average, about a quarter of OKC's COVID-19 hospitalizations come from outside the metro. Most of the patients in our hospitals are our own metro residents, but certainly a significant portion are not, and that adds further strain. To put our overall numbers in a national perspective and to return to that Los Angeles comparison from a moment ago, LA currently has 11 patients in the hospital for every 100,000 residents. That number for Oklahoma City is 35. A quarter of all our patients in our hospitals are now there because of COVID-19. These are not asymptomatic cases. These are not mild cases. They're not in the hospital because we're doing more testing. These patients are real people, and they are real evidence that our current wave is in many ways far worse than those we have previously experienced. These patients represent 484 families that have a lot of anxiety right now. I spoke to our city's hospital executives yesterday via Zoom and heard the strains this is putting on our healthcare system. Our community's healthcare system is essentially at capacity. Now it's just a daily decision about what level of care it will or can provide. It's not just about beds. We have plenty of big rooms in this city. We could fit a lot of patients right in here. We don't want for space, but we don't have the staff to handle these surges. No community would. It's as if our healthcare workers are responding to the aftermath of a tornado every day, week after week, month after month. No healthcare system is staffed to handle an extra 25% demand for months on end. And these staffing issues are compounded by the fact that the healthcare workers themselves are also potential victims of the virus. Right now, the number of hospital workers in our city that are quarantined for COVID-19 is 3 times greater than it was during our previous waves. Hospitalizations lag new cases, so this situation is going to get worse before it gets better, as the third wave of new cases spills into new hospitalizations. All we can do is weather that storm at this point, but we can lessen its duration. I'll say more about that in a moment, but first I want to thank our healthcare workers. We thanked them profusely in the spring when we had 60 people in the hospital every day. What they are facing right now is many times more challenging. So on behalf of the people of Oklahoma City, thank you to the doctors. Thank you to the nurses. Thank you to the PAs. Thank you to the respiratory therapists. Thank you to the transporters. Thank you to the phlebotomists. Thank you to the radiology techs. Thank you to the housekeeping staff. Thank you to the food service staff. Thank you to the lab workers. And thank you to the administrators. This city is grateful for each and every one of you. And now we must support you with more than words. We each owe an obligation to these healthcare workers. We each owe an obligation to our children unable to be in a classroom. We each owe an obligation to the many friends and neighbors who are suffering and in some cases dying. I say obligation. Some call it personal responsibility. There's been a lot of talk about personal responsibility the last few weeks, and I think some listeners have associated the words with the wrong definition. When you're asked to take on personal responsibility in this pandemic, no one is talking about taking responsibility for your person. You may think you want to play the odds. You may think you probably won't catch it, and if you do, you probably won't have a serious case. Well, first of all, you're wrong on both counts, especially right now. As I said earlier, every room you enter has COVID-19 in it, and about 10% of all cases end up in the hospital. You probably didn't think that number was that high. But in any case, you're not pushing your life or your health to the middle of the table when you make that bet. You're betting with my kids' education. You're betting with the health of a nurse. You're betting with the life of a 60-year-old grandmother who saved up her whole career so she could retire and enjoy her grandkids. When you lose your bet, we all pay the price. Every new case that gets added to the count ensures that school leaders can't safely open schools. Every healthcare worker who has to quarantine is a healthcare worker not available to take care of your heart attack. Every life lost leaves sorrow behind. Personal responsibility is an obligation you owe to your fellow human. Just because you haven't gotten sick doesn't mean you haven't been affected. It would be nice if you would take precautions for your own benefit, but please recognize that your choices affect far more people than you. So what specifically can we do to fulfill our obligation? I say we, because as I've told you from the very beginning, I can't do this alone, and in a free society, I can't force you to be a part of this effort. You have to want it. Whatever it is that motivates you, your own life, your own health, the lives of those you love, the kids of this community and their education, our healthcare workers, our healthcare system, and its ability to take care of you and this community when non-COVID needs arise. Those things are all on the line here, and we're going to meet this challenge together. When we began this journey, we took it a step at a time. Really smart people knew that we'd be having these conversations for many months to come. But they didn't say, let's give it our best 8 months. They said, let's give it 2 weeks of effort, and they framed it in manageable terms we could wrap our minds around. You know, believe it or not, Oklahoma City is one of the strongest rowing communities in the country. We are the home of an Olympic training facility for rowing and paddle sports. There's a phrase in rowing. It's called a power 10. It's when the coxswain, that's the person at the front of the boat, asks the rowers for 10 powerful strokes. Obviously, the race is a lot longer than 10 strokes, and she knows that. But it's a little much to ask for a power 1,000. So she asks for a power 10. I'm asking you for a power 10 today. I'm asking you for the next 10 days to take a break from higher risk activities. You know how fast we got into this current wave? About 10 days. In just 10 days, we went from around 300 cases per day to around 800 cases per day. A lot of people who contract COVID-19 experience symptoms just 5 days after transmission. At most, it's 14 days, but certainly by the 10th day after exposure, the vast majority of cases have manifested themselves. What that means is that if no one caught COVID-19 today in Oklahoma City, by Thanksgiving Day, a week from now, our case counts would plummet. Now, I get it. Somebody will catch COVID-19 today, tomorrow, the day after, and every day until we have a vaccine. Annihilating the virus is a worthy goal, but it's not a realistic one without a vaccine. But we know we can do better than this. And we know that we can bring these numbers down significantly if we just focus on it for 10 days. Here's what we're asking. First of all, as you likely know, the governor has reinstated some restrictions this week on restaurants and bars. They must keep distance between tables and must end all service at 11 p.m. except for carryout. I am issuing a new emergency proclamation today, incorporating those restrictions at the local level, which means they can be and will be enforced upon bars and restaurants by the Oklahoma City Police Department, as was the protocol during past waves of this virus. We are grateful that the governor set the tone with these actions. More than the substance of his orders is the significance that these are his first restrictions on gathering places since May. It reflects the seriousness of the current situation, and that seriousness of purpose must permeate all of our actions for the next 10 days. Restaurants and bars are not magical locations that are the sole sources of COVID-19 transmission. We have to approach this challenge comprehensively for at least the next 10 days. That is why I am also asking those who have authority over office locations to make the call to work remotely next week, where that is feasible. It is a holiday week already, and by this point, we're all pretty adept at working from home. In any case, do not hold in-person meetings in the office for the next 10 days. If you need to talk to a colleague, even if they're in the office next door, pick up the phone. Further, I am asking each resident of Oklahoma City to get takeout. Support our local restaurants, but for the next 10 days, do it with the highest emphasis on safety. I actually think most restaurants have done a great job prioritizing safety measures. I commend the Oklahoma Restaurant Association on its leadership. But it's what you, the patron, are doing inside that building that can spread this virus. It's actually something you can and are doing in a lot of places. And it is unquestionably the largest source of spread in this third wave. You are meeting your friends. And above all, this is the kind of activity I'm asking you to take a break from these next 10 days. Please do not meet your friends at a restaurant or bar or house party or church group or anywhere else for the next 10 days. I don't even know your friends, but right now I'm going to tell you, based on the city's numbers, your friends have the Rona, and you should do a Zoom instead. I get it that one of the hardest aspects of this pandemic is the isolation. But for the next 10 days, you have to weigh not just your health, but the needs of this city and its people against your desire to meet up. Sitting at a table with people from outside your household in a pandemic without distancing and without masks is an inherently unsafe situation. When you enter such an inherently unsafe situation, you're not alone in your own risk. You're carrying with you the hopes and health of every kid in this city, every nurse, every senior citizen, every person who also wants to see some semblance of normalcy return. For at least the next 10 days, it's okay to politely decline the invitation. When someone says they want to get together, just say that the mayor said we should catch up over the phone. I'm asking anyone in a position of influence in this city to elevate these messages of vigilance for the next 10 days. Pastors and other faith leaders, not only do you need to take precautions in your churches, but you can ask your congregations in your sermons this week to take precautions in all aspects of their lives. There is no greater challenge in our community this week than COVID-19, and you have the credibility to focus your flock on the crisis at hand. To the members of the media, you've been incredibly valuable to this community these past 8 months, and your work has saved lives. Thank you. Until we get these numbers back down, please amplify this message. I'm under no delusion that every resident of Oklahoma City is listening to me speak right now. But all residents need to know the magnitude of our current spike, and they need to know that they're being asked to respond. To anyone who is scheduled to host a civic club meeting, a wedding, a banquet, a luncheon, any in-person event that is indoors and is not distanced and masked, especially if it involves a meal where people typically remove their masks, should either reconsider or institute extreme precautions. Not everything has to shut down in the next 10 days. Many have spent these last 8 months learning how to adapt. That should be respected. If you're engaging in an activity in the next 10 days that is distanced and masked, of course it's not as safe as being at home, but it's probably not a major contributor to our current crisis. Some of the safest events held in the last 8 months involved hundreds, sometimes thousands of people. It's not about numbers as much as it is about distancing and masking. Unfortunately, the joy of an event does not put a force field around you. I know for a fact there are people getting married in OKC this weekend and the next weekend. On behalf of the people of Oklahoma City, congratulations on your upcoming nuptials. I'm sorry you have to get married in a pandemic, but you've got to incorporate masks and distancing throughout the evening. With the current numbers we have, we know there will be multiple people at your wedding that have COVID-19. Institute safety measures, assuming that is the case. To all people hosting a gathering, if you're watching me right now, you know what spreads this virus by now. It is people in close proximity without masks, spitting all over each other and hoping that they're not. Hoping isn't working. It's time to get real. And for at least the next 10 days, I'm asking for you to make some tough decisions. To anyone who has a platform, I'm asking you to use it these next 10 days. It is a scientific certainty that if we significantly mitigate the spread of the virus in the next 10 days, the numbers can come right back down to where they were 3 weeks ago. but it has to be front of mind for all of us. We have to work collectively to meet this crisis. The toughest challenge we all face in the next 10 days is, of course, Thanksgiving. We still have so much to be grateful for. And so the spirit of the holiday is one I still very much embrace. But the common practice of the holiday in the middle of a pandemic has the potential to be the worst super spreader event in human history. It mixes people from different households in close quarters, indoors, likely without masks or distancing, and on top of it, many of those people will be elderly. There are so many ways to avoid the worst consequences here. Set your laptop at the head of the table and do a FaceTime. Do a drive-by outdoor visit with your family members. Maybe even eat outdoors with distance, weather permitting. But just don't put 10 people around a table and expect nothing bad to happen. One of those people has COVID-19, and at the end of that meal, everyone at that table will have COVID-19. It's as simple as that. We also have Black Friday and Small Business Saturday coming up. Please be safe. Please keep your distance and wear your masks. Don't shop with people outside your household. Nobody wants to watch your death being reported on that 80-inch television you got for $49. So these are some ways we can get through this. Let's take a break from higher risk activities, OKC, for 10 days. Give me a power 10. Let's get these numbers back down. Do it for our kids, do it for our businesses, do it for our healthcare workers, do it for all of us. These efforts will be in addition to our existing ordinance requiring masks to be worn in public places. I am honored to serve with the City Council that has continued to prioritize the health of our residents. My continued gratitude to the author of the mask ordinance, Councilman Mark Stonecipher, and the other members of the council for their wisdom. This unity of purpose extends beyond the border of the city I serve. We are fortunate in the Oklahoma City Metro to have excellent elected leadership across the area. I want to specifically thank the mayors and council members in War Acres, the Village, Nichols Hills, Midwest City, Norman, Choctaw, Del City, Spencer, and Edmond for also adopting requirements in their cities that masks be worn in all public places. These are challenging times, but you are well served by the public officials at the local level that are doing everything they can in unique and challenging circumstances. And of course, the hardest work is being done by those whose names you may not know. People like City Manager Craig Freeman and his team, including Assistant City Manager Kenny Sudel, Deputy Municipal Councilor Amanda Carpenter, Christy Yeager and her PIO staff, Emergency Management Director Frank Barnes and the rest of the emergency management team, and of course, the Oklahoma City County Health Department led by Dr. Patrick McGough. Every single day, Dr. McGough and his team wake up and march to the front lines of this pandemic so you don't have to. They have risen to the occasion, and we will forever owe them our gratitude. When it's safe to hang out in bars again, I hope Dr. McGough never has to buy his own drinks in this town again. As always, wear your mask, keep your distance, and wash your hands. And for the next 10 days, give me a power 10, OKC, and let's get these numbers down. Now, Dr. McGough.
Good afternoon, and I agree with you entirely, Mayor Holt, for all of the folks that you thanked at the beginning and end and throughout your speech. Invaluable heroes to all of us, and I concur completely. Thank you. I also want to say to you that I will be forever in your debt, and we as a city and a county and a health department are forever indebted to you for the leading role that you have taken throughout this pandemic. I noticed an article this morning from the New York Times. It was about 5:30 this morning, and it was where epidemiologists were talking about the most important thing that you can do throughout this pandemic to help public health is to engage the elected officials and to have the elected officials share your message. And I want to thank you, Mayor Holt, because you have reached out to us repeatedly about how you could help. You have brought resources to the table, and I mean resources like partners, and you have consistently kept our data, our messages in front of the public in multiple media forums, and for that we are forever grateful. I too want to applaud your staff and your team. They've been amazing. And I appreciate forever our Board of Health, a group of amazing leaders. And internally, I want to thank Blaine Bolding, Phil Maytubby, LT Knighton, Emily Carmichael, and Linda Parker, all of our nurses, and our epidemiology team. And I too want to commend the media for how they have helped us throughout this pandemic. All of these individuals and so many more partners across our city and our county have been completely and totally invaluable to us and will forever be remembered for their efforts. Sadly, I want to say the latest White House Coronavirus Task Force report described the virus spread in Oklahoma just yesterday as exponential and unyielding. As the mayor just detailed, we have been on a steady incline in case rates and hospitalizations for weeks, and alarmingly, in the past 2 weeks, we have been breaking records consistently day after day. A model by our own county epidemiologist reflects that by January 31st, 1.3 million Oklahomans could be exposed to or infected with COVID-19. That is a sobering number. So to reiterate a few of the mayor's pleas, for the next 10 days, let's all commit to taking a break from higher risk activities, and whatever that we decide to do, let's wear a mask at all times when out in public. In public health, our number one priority right now is to get individuals to wear a mask. Masks work in reducing the spread of the virus. We now know that without mask ordinances, cities have a much higher case rate compared to cities where a majority are masked. I'm very proud of all the cities in our area that have passed mask ordinances, and I call on each and every citizen in our county, in our cities, to comply. I think it's important to note that if you have had COVID in the past, we have learned that antibodies may only last around 90 days, and there are documented cases where reinfection has occurred. So as we approach the holidays and colder winter months, there is an added complication I urge you to note, and that is the flu season. Last year, more than 500 individuals were hospitalized with the flu in Oklahoma County. And I think that's an interesting number when we compare that to the number of individuals that are currently in the hospital with COVID. And I think it's also important that we stop and think about, if we add an additional 500 onto that, what it would do to our hospital systems and our healthcare structures. A typical flu season has significant impact to our family and friends who are 65 and older. However, flu can also have substantial impact to young adults and children. It is more important than ever that you get a flu shot this year. If you are infected with flu and COVID-19, your immune system, as well as your respiratory system, could be overwhelmed, leading to devastating outcomes and even death. The flu vaccine can help keep flu symptoms from becoming severe. Additionally, getting your flu shot could potentially keep you from being hospitalized with severe symptoms, freeing our healthcare infrastructure to care for other critically ill and COVID-19 patients. And speaking of hospitalizations, referring back to the mayor's presentation, our hospitals are in need of your help. You are probably aware of national as well as local media stories regarding the dire situation our healthcare systems are facing. I too applaud all our frontline healthcare workers, whether working as a public health nurse, on the COVID units at a hospital or in the intensive care unit, in long-term care facilities, or on the front line as emergency responders. These are our true heroes of this pandemic response, and they need our help to avoid reaching a breaking point. We do not want to see that happen, so we need your help. As we approach Thanksgiving, please refrain from gathering with groups of people outside of your immediate household. Gathering in close spaces with such individuals increases your odds of being exposed to the virus and later transmitting it. The CDC details that 50% of COVID transmissions come from people who don't know they have the virus. Science reflects this is happening in Oklahoma County. Of incredible concern for me is that 2 weeks after Thanksgiving, we could have this story multiplied, adversely impacting our hospitals and our standard of care. So consider the cost. We ask you, consider the cost. As you make plans for your weekend, plans for Thanksgiving, plans for Christmas and all the other winter holidays and the New Year holiday, consider the cost of those plans. Consider whether that plan is worth spending 2 or 3 weeks in the hospital. Consider whether that plan is worth unknowingly giving the virus to your grandmother, your grandfather, aunt or uncle, or could potentially cost them their lives before the end of the year if exposed to the virus. Trust me, not seeing your family for one Thanksgiving is far better than having that chair empty next year and every year thereafter. Consider the cost. It has been a long year, and we know you're exhausted and you're ready for life to get back to normal. We cannot magically get there by going on about our life as if it were normal. If we all work together, however, we can continue to slow the spread until a vaccine is widely available. Our team has been actively engaged with the Oklahoma State Department of Health and local healthcare systems on the statewide vaccine plan. We submitted that to the CDC a few weeks back. We are committed to working with all our partners once the vaccine arrives to ensure its safety and efficacy before distributing to the frontline healthcare workers and eventually to the general public. In closing, I would like to ask that you remember our greatest tools, the 3 W's: wash your hands, watch your distance, and wear a mask. Thank you. With that, we will now take questions.
Okay. KOCO, do you have a question?
Hi, yes, I'll go first. It's Abigail Ogle here. Thank you. My question is about staying COVID safe in the workplace. I've received messages from workers from a variety of companies and industries who say, my company isn't protecting us or our customers. Some say that they're do work while still positive. Some say that they're working while they've still been exposed and masks are not enforced. They also say they feel bad because they're serving unknowing customers. Is there a place for workers like this to voice their concerns anonymously? What are the options for people who feel that their company is putting them and others at risk?
Thank you, Abigail. Excellent question, and I will do my best to answer that, and I also may need the mayor to weigh in on his options. We at City County will certainly take anonymous calls and follow up on them. We currently do. We have a group of individuals working as a part of our emergency response that have been deployed to that very cause. And so we care about those concerns. We will certainly work to educate employers, facilities, whomever, whatever the situation may be. We will work with them to address that situation, and we'll be more than happy to do so. We will help them develop plans. We will try our best to help them find resources if they need that for PPE. I know that the city and others are welcome and those kinds of information, and we can all respond together on that. But we have no problem with doing that, and they can certainly contact us anonymously.
Yeah, I think I'd just add that I think probably the most impactful thing is to receive a call from the Oklahoma City County Health Department. I don't know that we have any laws to enforce. I'm fairly sure we don't in the scenarios you're describing. But I think we're certainly willing. I mean, my office is willing to call people and call executives if they're not following at least best practices. Now, we may not have any legal authority over them, but I think a call from my office or from the Oklahoma City County Health Department probably does have some impact. So people are certainly welcome to reach out to our office at City Hall, 297-2424, if they have any needs related to COVID-19. We'll try to connect them with the best possible resource, and I think also calling the City County Health Department in the situations you described, Abigail, is probably a good bet as well.
Dylan, did you have a question?
I did. Hey, Mayor, I suppose I'll ask you the obvious one, which is, are you considering additional restrictions in the city or expanding on any of the governor's restrictions? Obviously not at this point, but are you considering that at this point, and what would those look like?
Well, I just asked the people of Oklahoma City to work from home, to not eat out, to avoid gatherings, and then we also took the governor's restrictions on bars and restaurants and are adopting them as our own, which adds enforcement. I mean, there's certainly a debatable question about who can enforce a gubernatorial order, and we don't want that to be a question in Oklahoma City. So we're going to take those on with our police department. So, I mean, when you take the sum total of what we've just described today, it's pretty significant, and we are hopeful, however, despite its significance, that people will listen, will see the numbers that we've seen, and will respond over the next 10 days, and will move the needle.
Okay, Fox 25.
Hi there, yes, this is Angelica with Fox 25. I know you just mentioned that OKC Police is going to help with enforcement. Can you speak a little bit more specifically of what they're going to be doing? Are they going to be just kind of patrolling and looking at different bars and restaurants, or can you kind of speak a little bit more to that?
Well, it's a big city. I mean, you know, we don't have enough police officers to be checking on everybody. We'll have to, obviously, as we always have in the pandemic, respond to calls. And that, honestly, that's to the greatest extent how they enforce laws in any case, right? I mean, we pretty much operate from complaints and calls to 911. So if people see that you know, a bar or restaurant is operating after 11 p.m. with indoor dining, they can do carry out. So, you know, if you see somebody walking in and walking back out with a sack at 11:30, that's okay. That's understood. That wasn't the intent of the governor's proclamation or our proclamation here at the city level. But if you're seeing a bustling bar or a restaurant full of people at 11:30 or 12 o'clock, again, that's a finite number of actors, and so we feel we can enforce that. It's obviously much more difficult for the police department to enforce things like mask ordinances, but when you're talking about just bars and restaurants, they handled this sort of thing back in March and April. This was exactly the same situation. We had, at that time, of course, bars were completely closed 24/7, and restaurants were operating under this carry-out only situation at all times. And, you know, we had some calls, especially early on. It sort of dwindled as time went on, but we certainly had some complaints. People would call 911, the officers would respond, and, you know, we always get compliance. People aren't interested in paying for a ticket, and that's certainly our first priority from a law enforcement perspective, is to get compliance. We're not trying to fund the city budget off of COVID tickets. We're trying to get people to be safe. So they'll respond to 911 calls on bars and restaurants that are operating openly and indoors after 11 p.m., and just as they did back in March and April.
Okay, non-doc. Okay, KFOR. Did you have a question?
Yes, this is Chase Horn with KFOR. Mayor, we've seen just how much division, you know, like the existing mask mandate can cause, and you spoke about how hopeful you are that people will listen to what you're asking them. But I mean, how confident, and I guess how optimistic are you that people will actually take these steps and do what you're asking for the next 10 days?
Well, first of all, I want to question the premise. Scientific polling that has been done in the state of Oklahoma demonstrates that well over 70% of people support mask requirements. So that is a very small minority. It can be a loud minority, but the vast majority of our residents support these requirements. And so I don't actually think there's been that much division. I think what happens is we get fatigued. And, you know, I may not be speaking today to the 20% of people who don't want to ever do anything for COVID-19, but, you know, we don't really need them to get these numbers down. We need that kind of, that group in the middle that did take precautions at an earlier time, doesn't have a problem with precautions, isn't opposed to precautions, but like everybody, just gets tired of it, and needs the mayor to say, hey, look at the chart. Things are going badly. It's time to do what you did March, April, and May. And I believe they will respond. Yeah, I'm very optimistic. I think that we just need, a unified voice across all levels of government and across the community. That's why I'm, obviously was reaching out to members of the media and pastors and other influencers today. And if we're all preaching that same message, I will remind you, there was a time when we were having like 50 cases a day. We thought that was our big peak, back in March and April. And it's the same, 650,000 people in this city, 1.4 million in the metro, and it's the same virus. So we can get those numbers down. We've done it before, and I think it's just a matter of kind of rallying the community and, reminding them how serious it is, and that's what we're trying to do today.
Associated Press, do you have a question?
Yes, Mr. Mayor. Are you prepared to ask or request that Governor Stitt issue a statewide mask mandate?
Sure, I've answered this question many times, but I will be happy to answer it one more. As the mayor of Oklahoma City, I don't think anybody cares what I think about what Guyman and Idabel are doing. So, obviously, the data shows that cities that have mask mandates have lower rates of transmission than cities that don't. And I don't know why the whole state wouldn't want to enjoy the benefits that we're having here in Oklahoma City. You think these numbers are bad that I'm showing today? They are. They are so much worse in the cities here in Oklahoma that don't have a mask ordinance. So why wouldn't the whole state want to have that same benefit? But that's not my job. I will say this, though. I am very comfortable speaking on behalf of Central Oklahoma. And here in the Central Oklahoma region, we would absolutely welcome a mask requirement that is brought from the state level. Early in this pandemic, when the very first restrictions were instituted at the state level, they were applicable on a regional basis. And I understand that theory, like, well, maybe not everybody's experiencing the pandemic in the same way, and we shouldn't have a one-size-fits-all, whatever. If that's the case, give us a mandate here in Central Oklahoma. And I've said this, you're the 7th reporter I've said this to, so this is not breaking news, but we would certainly welcome that because it would bring continuity across all of our jurisdictions in Central Oklahoma and would certainly simplify the process. We've got like 24 cities here in the Oklahoma City metro. All of them have to go through these, very complicated and time-consuming processes to institute their mask requirements and renew their mask requirements. And so we would certainly welcome a simplification of that. I'm not necessarily thinking that that's coming, but I've articulated that any number of times in public spheres and to the governor's office, and I would certainly praise that if that were ever done.
Storm, did you have a question? Storm Jones?
Yeah, real quick. Thanks, Mayor, for taking these questions. Sticking with the regional theme, you guys asked, folks not to meet for Thanksgiving next week, but just Saturday.
Storm, I lost you.
Storm, you cut out.
Saturday, 20,000 people will.
Oh, hey, Storm.
Storm, go back to the start of your question. Storm.
Yeah, I don't.
Storm, you're cutting in and out.
Yeah, you're cutting in and out, Storm.
Sorry. Maybe we'll just have to move on. But Storm, I'd be happy to talk to you later, maybe.
Brett with Oklahoma City Free Press.
My question, I don't know if you guys can hear me now.
You're cutting in and out, Storm. Storm, just email us.
Yeah, give your question to Dylan, and he can ask it later. That's a joke.
Okay.
It's an inside media joke there.
Brett with Oklahoma City Free Press.
Yes, Mayor, thank you very much for this time to ask questions today. Mayor, Oklahoma City, the metro has, at a number of small cities within the city. They still represent a lot of different restaurants and a lot of opportunities, for variances in this. I'm thinking about the Village, Nichols Hills, War Acres, where people go to restaurants there and probably don't even realize they're sitting in a different city. Have you been in touch with the mayors of those cities within the city to try to coordinate with them at all?
Well, yes, I am in constant communication with many of our regional mayors, and I feel as if today I'm speaking to everyone in the city, and I'm trying to appeal to your hearts and minds, because I know that you can go to other cities and do lots of things. And you can have dinner with people in your house. I mean, there's lots of options to meet, and it's not just in a restaurant in Oklahoma City. And so the most important thing we can do is persuade people that that's a bad idea, at least right now. And I think that, I hate to speak for others, but I believe that we've got some fantastic mayors and council members in these regional cities. I mentioned it in my remarks because many of them have passed the mask ordinance already. I think any of those certainly would concur with the desire that we all have to bring these numbers down. And I don't think they would disagree with the sentiment that everybody needs to get takeout for the next 10 days. And that even includes mayors and council members who own restaurants that I know of here in the metro. They all feel the same way. We need to buckle down here in the next 10 days, and I think they would support that statement.
Thank you, Mayor.
Okay, Bill Crum, the Oklahoman, do you have any questions?
And Mayor, I'd like a very quick follow-up if I could.
Of course.
You keep saying that you don't know why the people of the state would not want the same results that you're seeing in Oklahoma City thanks to the mask mandate. Why can't you cross the hurdle and say, I don't know why the governor would not want the same results we're seeing here in Oklahoma City?
Oh, well, I mean, I don't know. Are you looking for some sort of magic phrase? I mean, I feel like I've said this so many different times. I mean,
I think I'm just looking for yes or no. You know, should the mayor?
I mean, I feel like I've answered that. Of course. I mean, look, yes, of course.
Yes or no?
Like my colleague G.T. Bynum, I assure you that if we were in that position, we would have, just as we did in our own cities, we would want a mask requirement for all the people that we serve. Yeah, I mean, that's a no-brainer. I mean, how I feel about mask requirements should be obvious by the fact that I lead a city that has one, and I was very supportive of it. So I am a champion for them. They clearly reduce the transmission, and I am not the governor of Oklahoma. I can't make it happen for anyone but the people of my city, but we have made it happen for the people of our city, and we have enjoyed the benefits of it.
But you could say to him,
I have told his office many times, Bill. I have shared that message many times with his office.
I got a very quick follow-up. I think you said hope is not working. Did I hear that right?
Sounds about right, yes. Hoping that I think it was in the context of spitting on each other and hoping that you're not. That's not working, yes.
Mm-hmm. Okay, very good. Thank you, Mayor.
Okay, I have Storm Jones's question. He said, you mentioned a regional approach earlier. You have asked folks to forego Thanksgiving next week. However, 20,000 people will be gathering in Norman Saturday for a football game. Do you understand perhaps why people are confused about different standards?
Yeah, so that's a great question. I'm actually glad you could kind of tee that up, because I don't view it as a different standard. I'm not a public health professional, but when people are outdoors masked and distanced, I don't really have much concern. I mean, it is safer to watch that game at your house than to do it in Norman, but this virus is being transmitted at Four Tops. This virus is being transmitted in office conference rooms. This virus is being transmitted in living rooms where people are not distanced, they are indoors, and they are not masked. If you have that trifecta, you are catching the coronavirus, especially right now when so many people have it. You know, being outdoors distanced and masked like they'll be at an OU game, I mean, again, it's not as safe as staying at your house, but a lot of people have put a lot of thought into trying to do large gatherings safely. And if it includes masking and distancing, it's probably okay. And if it includes being outdoors on top of it, you know, again, that's not going to drive our numbers up, that OU game. That's not a super spreader event. People, an entire city eating around a table next Thursday, that's a potential super spreader event because they're not masked, they're not distanced, and they're indoors. To me, it's the same standard. The same standard has to be applied regardless of how many people are there. and it's about masking and distancing, and obviously if it's outdoors, that's even preferable. As I said in my speech, it's not about the numbers, it's about masking and distancing.
Okay, does anybody else have any questions? Okay, thanks for joining us.
All right, thank you all. Wear your mask, be well. Let's get these numbers down.
Thank you.